Well, welcome back and thank you so much for joining us for our live coronavirus town hall.
Tonight we will be joined by 5 special guests who are leaders in our community. First up, we have Medical Director of Emergency Management at Mayo Clinic, Dr. Pratish Tosh, and Director of Public Health for Olmsted County, Graham Briggs. Welcome, guys, to the studio.
Thank you. Before we jump into questions from our viewers, thank you, all of you viewers who submitted excellent questions. Dr. Tosh, what do we need to know before we get started tonight? Go ahead.
Yeah, sure. You know, people are looking at what's happening now and say, well, what are we doing now to prepare?
Right.
And as Mayo Clinic, we've been preparing for pandemics for decades and have learned a lot from the 2009 influenza pandemic, but also things that have happened in between, including Ebola 2014, Middle East respiratory syndrome. And so our preparedness didn't just start 6 weeks ago, but has been building on really a legacy of preparing for anything that's going to come up.
That's so reassuring to so many people who have those questions. Are we prepared? And so you're saying, yes, we are prepared.
I think that's a safe statement. We're going to do everything we can. And this has been building on really just decades of work.
Yeah.
Okay, and thank you, Dr. Tosh. As we mentioned, we also have Graham Briggs. He is the Director of Olmsted County Public Health Services. So do you have a quick statement for us before we jump in?
I think like Dr. Tosh, we have been working on this for a couple of decades now, really, in public health departments all over the country, really thinking about if we were to see a pandemic or a large event. And so while we're prepared, I think we both agree, too, that we are in unprecedented times here in this country. We're seeing a lot of things that we haven't ever seen before with school closures and sporting events and things like that. So I think all of us are really adjusting to this new norm.
Yeah, absolutely. So first question is for Dr. Tosh, and this is a question we got from a number of viewers, actually. When do you expect COVID-19 to peak here in Minnesota, and are we safe to resume some normalcy by June before summer really gets into full swing? What are you finding?
Sure. This is unfortunately a long answer to a short question.
Go ahead. We got time.
We are right in the beginning of this for Minnesota. And looking at the experience from China, they had a good 2 months of things being pretty rough. But recently, there were no cases there. In fact, in the city of Wuhan itself, which is the epicenter of this, 0 cases for the first time. And so there's a light at the end of the tunnel. Even though we're at the beginning of this, we can see that light. Unfortunately, the only way out is through. And so this is going to be a difficult couple of months.
A couple of months.
I think just based on what we're seeing elsewhere. And there's a lot of things we can do to affect that. The kind of social distancing that we're doing, I can't even touch Graham.
Right. 6 feet apart,
right,
6 feet apart or more.
And people staying inside and not really engaging in mass gatherings, these sort of things. These actually work. And we're going to do what we can to try to limit the spread so that the number of people who are infected, we try to decrease those, but also try not to overwhelm the healthcare system, not just here in Rochester, but throughout the state and throughout the country.
So some people think, okay, maybe a few weeks, but you're saying this really may be a couple of months that we're looking at here.
You know, I'm expecting...
Realistically.
Realistically, we're right in the beginning of this. Okay. And I'm expecting us within the next few weeks to really hit our peak, and then it'll come down in the same fashion that it came up. And that's what we're certainly looking at the experience from China. I think we can see the same thing. The longer part of that answer is, after that, tough to know what's going to happen. So either the virus can disappear entirely, like in 2003 with SARS, or it can reemerge periodically, as we see with certain kinds of bird flu,
right.
Or it can become endemic. For example, Middle East respiratory syndrome, which is endemic in parts of the Middle East. And so we don't know quite what's going to happen after that. And so we got to be prepared.
And concerns, of course, the Spanish flu of 1918 in the fall, like, you know, it kind of subsided in the summer, and then, boy, it just came back with a big roar in the fall, and that's when we had so many fatalities back in 1918. So you don't know. Yeah.
Okay, our next question tonight is for Graham Briggs. Do you know how the confirmed cases, those patients who have tested positive for COVID-19, are doing today?
Well, this one we've got a short answer. So, luckily here in Olmsted County, the handful of cases that we've seen and confirmed are all doing well. They're out of the hospital, and so we've been lucky so far here.
And we are currently standing tonight at about 6 confirmed cases in Olmsted County?
Right. We know of 6 confirmed right now. We are, at this point, really starting to investigate more suspect cases as they're coming in. And so that number's starting to change pretty quickly. But as of today, we're at 6 officially.
Okay. Thank you, Mr. Briggs. Dr. Tosh, viewers want to know how long after exposure do first symptoms appear and how long after exposure before you can spread the virus?
So let me answer the second question first.
Yes.
And the predominance of the transmission occurs from people who are sick. And there are going to be cases here and there where somebody didn't really feel any symptoms whatsoever and may have spread the virus. But those cases are really, there's a real minority of this. The vast majority of transmission is happening from people who are sick with it and coughing and sneezing. And it's those respiratory droplets that get onto surfaces and get on people's hands and they touch their face and then they get infected. So that is the predominance of the transmission. We say usually it's between a week to 2 weeks that people, from the time they're exposed to the time they start to develop symptoms. It can be as long out as 21 days, but really the vast majority right around 7 days, 7 to 14.
Is that kind of the magic where you hear about the 2-week quarantines just to make sure that those symptoms arrive and pass?
That's exactly it, and that's the basis of the 2-week quarantine, that the vast majority of people who are exposed would develop the symptoms of the disease within 2 weeks.
Okay.
Have you seen it where it's gone beyond those 2 weeks? I mean, I've been hearing too that, in some cases you got to wait for 20 days before it may reveal itself. What are you hearing on that?
There are some cases where it's a little farther out from that 2 weeks, but again, those are rare, and when you look into them further, it can be a little bit, sometimes the data isn't always clear, like, well, maybe they had a different exposure 7 days later or something like that. So maybe the 21 days was actually 14.
Okay.
And so it can be difficult and murky, but when you're looking at the data across now several 100,000 people infected, it really looks at the vast majority are going to be within that 2 weeks.
Yeah. Okay. All right. And Mr. Briggs, for Olmsted County, again, some of these questions, responses may overlap a little bit, but from another viewer, for Olmsted County, is it possible to know if cases are community spread? And if so, how soon until we here in southeast Minnesota know, until the public knows about the cases?
Right. So anytime a case is identified, we're working with the Minnesota Department of Health, and we're doing this locally too. We do what we call a case investigation, and so we call that person, we talk to them or their family, and really look at where they were before they got sick. And we know this virus well enough; we're getting to know it better and better. And we can look at where they were before they got sick within that time frame that we know they must have gotten exposed. And if they were in Washington or Italy or something like that, we can feel pretty comfortable that that's where they got exposed and then brought the virus back here. What we're really looking for in these case investigations now in Minnesota is, did they not go anywhere besides locally right here in town? And if we can't find a risk factor, then we start looking at, is there local transmission happening? We don't have any evidence of that here in Olmsted County so far. We do know of a handful of cases now in the Twin Cities that the public health experts can't tell you where they caught it. So we do know that we're seeing some transmission now in the Minneapolis-St. Paul area. I think unfortunately it's a matter of time at this point before we find local transmission here, but that's something that we're really actively working hard at right now as we investigate these cases, is to try to figure out exactly where people are getting it. And then while we're still in containment, identify those people that they subsequently exposed and make sure that we're not allowing that transmission to go through additional people.
Yeah. Another question from a viewer, can you tell us which communities in Olmsted County those positive cases are? Can you tell us where those are in?
Sure. One thing we really need to think about seriously when we're looking at infectious disease too is people's privacy. And so if we're looking at a smaller town or a smaller population, we want to make absolutely sure that we don't accidentally reveal someone's identity by saying that there's a case in this town or that town. I think in Olmsted County, we've got a tight enough community here that we can say that if it's in one place, we probably feel pretty comfortable. We're really all economically linked in this county, regardless of if you live in Rochester or Byron or Stewartville. So I think as a community, we can say if it's here, it's with all of us.
And there's a little bit of stigma there too, isn't there? I mean, if you think, oh, my neighbor has this, and there's, you shy away from that. I mean, do you see any of that at all, or hear about that?
Well, you potentially could. I think with infectious disease, a lot of the time, there's potentially stigma. One thing I learned as an infectious disease epidemiologist in my younger years was that disease like tuberculosis, that a lot of people think is eliminated from this country, is actually still around, and there's a lot of stigma with it in certain cultures where this is still a fatal, disease that people are scared of. And so, with this particular disease, there's that opportunity that people can associate different ethnicities and things like that, and that's something we really want to make sure that is apparent to the community, that this virus doesn't care where you're from or who you are. It genetically just wants to jump into the next person and cause disease.
Any of us.
Right.
And this next question is directed at Dr. Tosh, but Mr. Briggs, of course, you can jump in here as well. What is the rate of false negatives and positives?
So we are confirming some of our positive tests that we've gotten with other means. So it doesn't look like we're having any false positives. It's going to be a while before we really understand if something is a false negative. That it might be that maybe somebody wasn't actually having symptoms or things like that. And so it's going to be a little bit more experience before we understand that, because this is a new test and a new disease. But the science behind that test is relatively old. And so our experience with other tests like it suggests that our false negatives in people for whom the test is recommended, so namely people who are sick with the disease, that our false negative rate is going to be pretty small.
Absolutely.
Mr. Briggs, did you want to tie into any of that at all, or?
Oh, I think Dr. Tosh is a great expert on PCR and the testing, so you said it.
So another question from a viewer, in Olmsted County, why are schools closing but not daycare facilities?
But I think this is something that it comes down to a variety of different things, but in this state, the governor has the ability to change how schools operate as far as the school year goes, and so we've got some flexibility there. I know we've got Superintendent Munoz coming in.
Right.
We might be able to talk about that.
He'll be here in a few moments.
Yeah, but there's also the thought about what sort of impact it has on the community when you close a school or a child care center, and so right now we don't see a whole lot of evidence that we've got community-wide transmission going. If we say shut down child care centers, we really probably have a limited lifespan to that before really causing disruption to the community. And so there's some argument here to think about exactly when we do that, how long we do it for, how we know that we're going to turn it back on once we turn it off. And so it's not an easy decision to say that we should just shut down daycares,
right,
for the next 6 months or something. A lot of viewers out there, I'm sure, can think that would impact their lives.
Absolutely. And Dr. Tosh, this next question has come up from a number of you viewers.
Many times, yes.
So if you have the virus and if you recover, can you contract it again? Is that a possibility?
Yeah, of course. I've learned in my career never to give absolutes.
Right.
But I will say that the preponderance of people who get infected will develop immunity and not get it again. There are cases that people say, oh, they got it again, or they detected the virus again, and somebody had it previously. And so those cases are going to be out there. But the vast majority of people who get infected with this will develop immunity and likely not get it again.
But could it develop into another strain? And is that a possibility too? So you may have a certain strain,
mutate
now,
in any way,
and then in the fall have another strain. I mean, is that?
So that's something we're going to be looking out for.
Yeah.
And we already know there's 4 coronaviruses that cause the common cold. There are other coronaviruses that have caused SARS and Middle East Respiratory Syndrome, MERS. And obviously we're watching to see what happens with this coronavirus and as things develop over time. But right now, with the strain that we're seeing, the vast majority of people who get infected with this shouldn't get it again.
Okay, good. A sliver of good news, in the scheme of things.
Silver lining.
Yeah, silver lining.